Hey everyone, what's up? This is Dr. Charlie PT. Hope you're doing well. And really quickly had something come up that I want to share with you, and it's this idea of what does it mean, right? If you're trying lots of different motions, lots of different treatments aimed at fixing the physical body, right? This might be certain exercises or certain treatment protocols, right? Certain methods, the McGill method, the McKenzie method, right? Just lots of different physical treatments, maybe even shots or perhaps even previous surgeries. We work with lots of people who've tried lots of things and it hasn't worked. What does this mean, right? What could this mean? And so real quick, again, my name is Dr. Charlie. I'm a PT. I have my orthopedic board specialty. I help people all around the world with back, butt, and sciatica problems learn to fix themselves using the power of their mind and movement as medicine. So this is my exclusive specialty. This is all I do. And I can't tell you how many times people have tried all kinds of different treatments and they haven't worked and they're just completely puzzled by it. But the lack of response to a physical treatment isn't confusing at all. It actually makes a lot of sense if you think of it in the big picture of what could be happening and what could be driving your symptoms. So at the end of the day, pain is an experience created by both your mind and, inputs from your body, okay? But really, the mind is the CEO. And so I had somebody who came into the program and was like, hey, I'm trying all kinds of different motions, and I'm worried that none of these motions are going to work. And they've gone through 5 rounds of testing some things. There's a testing process we give to people. They've gone through 10 rounds. They've gone through 15 rounds. They've gone through 16 rounds. All kinds of different rounds of treatment, if you will, right? Meaning just blowing through a bunch of different motions, and it's not working. And this person, you can see, right, like the anxiety almost building up, right? Oh my gosh, like if I get to the end of these motions, this is gonna be another treatment or another process that doesn't work. But the fact that this person is not responding to mechanical treatment is actually a sign that it might be caused by, their pain experience might be caused by their mind, right? So think of it like this. If you have a problem with your brakes in the car, all right, and you take it to one mechanic and they change this part of the brakes, right? You go to another mechanic and they fix this part of the brakes. And you go to a couple mechanics and they change everything associated with the braking system. And the car's still squeaking, right? So the car was squeaking. You thought it was the brakes. You went to all these different mechanics, right? They fix everything with the brakes. Now you have like 3 sets of new brakes. But the car's still squeaking. Was it the brakes or was it not the brakes? Now, right, if the only thing you know how to do is repair brakes, you're going to say, oh my gosh, what do we do? What do we do if we fix the brakes again and it doesn't work? But somebody who's able to step back would simply say, and probably even you listening to this story, you'd probably say, well, it's probably not the brakes. Now, maybe you don't know what it is, right? But logic would, say that, hey, if the car is squeaking, you think it's your brakes, but you replace all the different components of the brakes, well, then it probably wasn't maybe the brakes causing the squeak. Now, I really know not that much about cars, okay? But you could apply the same concept to the body. So let's just say that, I don't know, there's this little niggle in your back or your butt, right? And you try moving your body mechanically all kinds of different ways. You pay for a bunch of people to move your body in a bunch of different ways. The chiro, the osteopath, the acupuncturist, the massage therapist, right? All kinds of people. You get shots in all these different areas, the SI joint, the back, this joint, that joint. Maybe you get even a surgery, right, to fix a part of the brakes, to fix a part of the back or the butt or the leg. But you're still having pain. Now again, because your current pain paradigm is one of, hey, when I hurt, that means that there's some physical damage and or structural problem. And that's kind of all I know. That's just how you understand pain, right? It's this very physical phenomenon. So if I hurt, there must be something wrong and I've got to fix it, right? But now me as the outsider, right, is watching you do all these different physical things and saying, hey, look, if the problem is mechanical, right, if there's a problem with your motion system, you should be able to change it with motion. Hopefully it makes sense, right? If I have a rotator cuff tear on my shoulder, I should be able to move my shoulder in some way and identify some significant weakness or pain or problem. Hopefully that makes sense and you would agree with that, right? And so if your joints in your back are a problem, if the piriformis is a problem, and you're doing all kinds of stuff, moving it this way, that way, forward, back, left, right, rotating it, twisting this way, you're doing all these different physical treatments aimed at fixing the physical structure, and it's not working, then you're scratching your head because, again, right now you might believe that all pain equals physical damage. And so there's got to be something wrong there. But you just replace the brakes and the car's still squeaking. You just tried to target that specific tissue in your body and it's still squeaking, meaning the alarms are still going off. So what's happening? could it be that it's not your physical body? And you're barking up the wrong tree, meaning you are trying to treat the physical problem, right? Because you feel this physical pain, but it's not due to structural damage. In which case, again, it probably suggests you're trying all these physical treatments and you failed them, nothing works. All the chiro, all the PT, all the massage, all these exercises, and it's not working. Well, could it mean that, again, they're targeting the wrong thing? They're trying to fix your butt and your back and your leg, but it's actually being driven by something else. And what could it be driven by? It could be driven by the mind. All right, you can actually feel, it's all real, you can feel physical sensations. You can point your butt and say, ouch, right here, it hurts. And it might not be your butt at all. It could be the mind. Right? So you can have a physical manifestation of a psychological type of issue, a psychological stressor, a psychological danger signal, if you will, anxiety, fear, worry, concern, something else going on in your life, right? That could be showing up physically for you. And of course it's not going to work because they're only considering the physical body. Hurt equals harm, pain equals damage, but it doesn't always. And so instead of feeling anxious about these physical treatments not working, consider that maybe the lack of response to all these different things actually means something, but maybe you're just not thinking in a way that's able to help you connect the dots. All right, again, if you believe all physical pain is due to physical problems, which sometimes it is, we can help people with that, and we do often, right? But sometimes it's not. And so if you're believing that all physical pain is due to, again, something damaged within your body, then you're going to go through all these mechanical approaches and you're going to be super frustrated by the outcome. It's not working. It should be working. If there's something in there, I should be able to fix it. So you go under the knife, you get shots, you take pills, you take steroids to reduce the inflammation, you do all kinds of stretches, you work with different specialists and chiropractors. This is the best chiro ever. Right? This person has magic hands. Yep, it doesn't work. Why doesn't it work? Not because that person's necessarily terrible at what they do, but they missed the boat. They don't understand that pain can not only be physical, and maybe you don't understand, until maybe watching this video, that pain isn't always physical. It can be psychological. Now, some people take that the wrong way. They say, Dr. Charlie, you're telling me I'm making this up. You're not making it up. Do you feel your pain that you're experiencing? If you have some type of back, butt, sciatica problem, you're watching this, do you feel pain? Then it's real. All right, you're not making it up. I'm not saying that, okay? But understand that you're going to want to look at not only the physical side of things, but also the mind, right? The brain. You can actually learn to experience pain. You can actually kind of groove these neural circuits, if you will, such that over time, pain becomes an experience that you're very, very familiar with. And so then we take the approach of reprogramming your reaction to pain, helping you view pain in a different way, helping educate you on what pain is and what pain isn't, because it's not always due to physical damage, and you start to see results. So in which case, we start to treat the mind, using the mind, but then also, instead of targeting treatments to fix something in your butt, your piriformis, your SI joint, to make it more stable or whatever, right? We start to use movement as a way to enter the nervous system. We start to use movement as a way to get you feeling better and just getting you feeling more safe. All right, so something to think about if you're watching this, you've tried lots of physical treatments and you're just like, man, why is this not working? How is this possible? There's got to be something else. Maybe this video isn't enough. Maybe you need to try a bunch of other things that still don't work, and I get it. Maybe you're not at the end of your rope yet, so you can't buy into this, all right? But at the end of the day, recognize that all pain does not equal physical damage, all right? And especially if you've tried lots of physical treatments aimed at fixing the mechanical body and it's not working, consider that maybe you need to look upstairs or somewhere else, all right? Hope this was helpful. Let me know your thoughts below in the comments. And look, if you are wondering, maybe what the driver of your symptoms are, right? Maybe you need more evidence. Maybe you need to kind of like think about it a little bit more, right? And pick up some more clues. And be sure to check out my Better Than an MRI DIY Diagnostic Guide. Scroll to the very bottom where I talk about the missing piece. And the mind is one of the missing pieces that so many people, well, they miss because they're just not aware of it. Doctors aren't trained on this stuff, right? And so check it out. Again, download the DIY Diagnostic Guide. Scroll to the very bottom. Watch the video. Should help you out. Let me know your thoughts below in the comments.